Of the phylum Vertebrata, the vertebrate, there is a class called amphibia. The word amphibia means double life, and the animals in this class are the ones which live part of their lives, usually the earlier part, in water, and part on land. In all amphibian work, even though anesthesia is used, it is an extremely good practice to render the animal senseless to pain. This is done by destroying both the brain and spinal cord. The process is known as pithing. If one goes down the mid-skull, a depression is felt, at which point a dissecting needle can be inserted and passed down the length of the spinal column. It destroys the spinal column. Destroyed. Other organs function has no sense of pain. Suppose now we take a look at the gut cavity and its contents. In doing this, you'll first make a slit through the skin using a pair of blunt scissors and cutting all the way up past the breastbone. Having done this, the muscles, which form a rather nice band at the mid-ventral line, again make a nick into the muscle mass and carry the slit following the same line that you did when you cut through the skin. And you do have to cut through the breastbone, which you just heard. If at this point one grasps the two cut ends of the breastbone and pulls outward, again, your best dissection instruments are your fingers. You can pin the animal down in this position, making it very easy to work on the internal organs. Notice the heart beating rather actively. One can even at this point see that there are two separate areas in the heart, two atria, and one large ventricle. The large structure coming out of the ventricle is the conus arteriosus, the main artery leaving the heart. Rather than pursue a dissection of the blood vessel system at this point, let's defer that until after we've examined the organs in the gut cavity. The liver, the largest gland in the body, is composed of 3 lobes. And surprising though it may seem, this large black sac is the gallbladder. In some specimens, the gallbladder may appear green. These thin-walled sacs, directly behind the liver, found on both sides of the animal, are the lungs. In order to look further, we'll have to enlarge the original cut practically down to the pubis, and we should make 2 side slits to completely expose the viscera. We saw the liver earlier, and if we remove it from the field of view, you see a large muscular organ, the stomach, and up in this corner, the attachment of the stomach to the esophagus. The stomach leads to the duodenum, the first part of the small intestine, which is somewhat coiled, although not as much as in man, and finally leads into the large intestine, and I think you can see the difference in size, small intestine, large intestine, and this ultimately empties into the cloaca, from which wastes are excreted. If you look at this movement, this is a normal which moves food along the digestive tract. You'll notice also by this time that the frog has ceased to live. And if we move the liver out of the way, we should be able to explore now some of the other organs in the gut cavity. Between the curvature of the stomach and the duodenum lies a gland which is essential for digestion, the pancreas. This is best seen from the underside. Notice this yellowish structure, the pancreas. Notice also that there is a thin tissue throughout the entire digestive tract. This is the mesentery. And the mesentery suspends the entire contents, all of the digestive organs, from the back body wall. In the mesentery, one also finds this small, dark, brownish red organ, the spleen, whose function is the production and destruction of blood cells. Looking a little deeper into the abdominal cavity, one notices some large finger-like projections. These are fat bodies. They are associated with the reproductive organs, and this being a male frog, the reproductive organs are testes, one and the other one. Looking very closely at the testes, they are connected to the kidneys by very fine ducts, the vasa efferentia. And it is from the testes through these ducts that the sperm pass on their way to the kidney. Let's see if we can get a better look at this kidney. Well, here's the left kidney, a large, dark brown mass. And this lighter yellowish area, which is just barely visible, is the adrenal gland. From the base of the kidney is a stout tube, the ureter, through which both urine and sperm pass to the cloaca. For comparison, let's take a look at the female frog. First, a preserved one, showing a huge number of eggs in the body cavity. Should you get one of these as a dissection specimen, you'll have to remove all of the eggs before you can see any of the internal organs. Looking now to a frog, still a female, which has already laid her eggs, we can see these large yellowish masses and the associated fat bodies. When the eggs are shed in the body cavity, they travel down this fine tube, the oviduct, which terminates in the uterus, a very thinly branched organ that empties into the cloaca. It's of interest to point out that in the frog, the urine passes first to the cloaca, then to the urinary bladder, this large, flabby structure, since there's no urine in it at this time, and upon contraction of the urinary bladder, the urine goes back to the cloaca and is excreted from the organism. At this point, we should take a look at the circulatory system of the frog. And we're switching to a preserved specimen in which the arteries have been injected red for better visualization. This will probably be a rather long dissection because one must be very careful in dissecting the conus arteriosus as it leaves the ventricle. It's possible to see that this branches into 3 smaller arteries, The first of these goes toward the head, therefore it must be the carotid. The second curves and goes deep behind the heart and appears to go down toward the stomach along the back wall. This must be the systemic branch. And the third branch immediately forks. One branch goes to the lung, the other to the skin in this area. That must be the pulmocutaneous. This is the point at which we left off a consideration of the systemic. Notice that it travels against the back body wall, joining the right systemic, sending off a branch to the mesenteries and intestines, and behind the kidney, becoming the dorsal aorta with these renal branches coming off. If we follow this down a little further, practically to the bottom of the body cavity, you'll notice the branching of the dorsal aorta to the iliacs. Looking to the veins, which are rather collapsed in this specimen, we can easily see the left precava, the right precava, the postcava, and the triangular sinus venosus. The central nervous system is divided into the brain, the spinal cord, and the nerves branching from the cord. To reach the system, one must first remove the skin along the midline of the back, and the skin is tough in this region. Clear up. Past the eyes. Having done that, you can see a depression which corresponds to the spinal column. If one slices at this point, and don't worry, you're not going to go through the bone, but be careful when you use a scalpel. Try not to cut quite toward yourself. One should at this point be able to rip out this muscle mass, and this is a blunt dissection. A little scraping with a scalpel, and even though I'm scraping toward myself, the blade is pointed away from my thumb, brings us down to the level of the spinal column. Now, there's no sense in starting an exposure of the spinal cord down here. One may start in the mid-region. With an old pair of scissors that must be relatively strong, begin by inserting into space between two of the vertebra or bones which go to make up the column, snip away, and with a pair of forceps, lift the bone and attached muscle . This is a rather long and tedious process. So let's take one frog that has already been dissected with the brain and spinal cord. The brain is in this region. This is the spinal cord. We've now finished our generalized dissection of the frog. There are many specialized techniques, which we won't go into now, but regardless of the type of dissection that's done, one should always, upon finishing, make sure to clean his instruments well.